Okay, just going. Recording. That was Tumblr. Hi, everybody. So my cough has gotten significantly better. So I thought I'd make a video. One time I was thinking about making a video about giving myself a testosterone injection, which I'm not actually going to do, because when I tried that, I just fucked up my injection, and then had to start over. And that's annoying. So anyway, I'm actually working on my testosterone injection right now, but I'm not going to videotape the whole process. I just thought it'd be better to be doing something while I was talking to you. Look, needle. Excuse me, I still have a cough. It's still pretty fucking annoying. So, what's going on? I still haven't noticed any changes. This will be my 4th injection. I got labs back from the doctor. Went in to see him this week. And he says my testosterone level's pretty low for the standard male. So he said I could increase the dosage a little bit if I wanted to. I'm not sure how I feel about that because, oops, shit, I did something wrong. Because I've been sick. I don't know, man. I just don't know. I feel like if I've had some changes and stuff, I don't know if I would have noticed them fully. So I don't know if I want to increase when I'm still not fully aware of how I'm feeling affected by this. 1, 2, 3, 4, 5. So I don't know. So today's injection is going to be 1 milliliter. Make sure there's no air bubbles. So yeah. So I'll talk to my therapist on Monday and work out that. I don't have to figure it out right away. I have time. Saying I'm just picking the spot where I'm going to inject myself. Yay, injections. Gonna make sure it's in a nice meaty spot. That I got no varicose veins going on. Sucks having varicose veins. Make sure you clean it real good with some alcohol swab. And then you've got to put on a smaller needle, because the needle you use to draw the testosterone up is kind of big comparatively. This is, what is this, 25 gauge? 25 gauge is small. Look, just like in the movies when people take heroin, you do this. Ah, how cool is that? I'm still not confident I got all the air bubbles out. Let's try something. Oh, and there's a little drop of testosterone coming off there. That means it's good. Here's the fun part. Here's the part where I kind of choke a little. I have to go 1, 2, 3 and jab it right in. 90-degree angle. It's going to go in there. And the thing is, while I'm not afraid of needles, still have not gotten used to putting needles in my own flesh. But at least this is the first time I've perfectly actually loaded it up with the testosterone in there and not screwed anything up. So that is exciting. So just about while I mentally prep myself. Pinch it a little. 1, 2, 3. Got it in. Totally does not hurt. Totally does not hurt when I do that, but I worry about it. It's all freaky giving yourself a shot. I mean, I guess I'll get used to it. I mean, I have friends who are diabetic and give themselves shots all the time. One of my friends, she, it's hard to get it in there. Just a sec. Testosterone's an oil, so it's pretty thick. So you have to really squeeze it to get it in. And a little swab. So, yeah, anyway, my friend who's diabetic, look, I'm all done. She is afraid of other people giving her shots because she's used to giving herself her own shots. Who knows, maybe eventually I'll be like that. Oops. And then, time for a Band-Aid. See, that's not hard. Giving myself a shot didn't hurt. Nothing freaky happened. There's like very little blood, if any. Let's see, did I bleed at all? Tiny bit of blood. Hardly anything. But every time, freaks me out a little. Oh look, here's the Band-Aid my doctor gave me. He likes Angry Birds, so he gave me Angry Bird Band-Aids to use. Because I guess he was afraid I wouldn't have Band-Aids, I don't know. I had to buy a whole bunch of alcohol swabs. So you gotta use that to stay nice and clean. So yeah, there's my 4th injection. So that's 2 months now that I've been doing testosterone. I guess I wanted to talk a little bit more about my identity. I've mentioned before that I don't identify as a trans man, as a female to male exactly. I identify as genderqueer. Gender fluid, which I guess is a kind of genderqueer, so genderqueer was correct too. But a gender fluid person, their gender isn't set 100% of the time. I am comfortable with male and female pronouns. I'm comfortable going by my birth name of Corinne or going by my nickname of Corey, which practically is my birth name since Mom named me Corinne so she could call me Corey for short. And everybody in my family called me Corey for years. But sorry. But I do want to present as more masculine, so that's why I'm taking the testosterone. I'm hoping for facial hair, especially sideburns, because sideburns are awesome. I'm hoping for a more masculine voice, and potentially some other changes. And what else? Oh, and I think I mentioned I want to get top surgery, chest reconstruction, because you know what? It sucks having giant boobs anyway. And I don't see the need to have them at all. And I will probably, in my professional life at work, just go by male, because that's easier. Explaining gender fluid to people who aren't really open to the idea, who are just getting used to the idea of transgender in general, it's difficult. It's not easy to explain gender fluid. When I was telling my supervisor about it, she thought I said gender fluent, which is what she now calls me, and that's cool, because I think it's funny. So yeah, so at work, people will call me by male pronouns, they'll call me Corey, and that's cool. And then outside of work, whatever happens, happens. But I think I'm looking forward to the idea that I can put on a suit and tie and have people call me sir, or I can decide to put on a skirt and jewelry and have people think of me as a lady. So this is clearly the international symbol for a lady, because I'm wearing jewelry, I guess. So that's it. So I will make another video at some point in the future. Bye.